Sawadika, you're watching NNT News Talk. NNT News Talk is broadcasted every weekdays on the NNT website at thainews.prd.go.th and also available on the APAC channel. The medical tourism industry here in Thailand is booming, with up to 1.3 to 1.4 million tourists traveling into Thailand to receive utmost care here in Thailand itself. Please welcome to our show an expert in tourism and most importantly to talk about the medical tourism industry boom here in Thailand. Please welcome Professor Dr Zadok Lempert. Sawadika.
Sawadika.
Thank you very much for joining our show today, and also you're here to talk about medical tourism. I'd like you to firstly explain briefly about what medical tourism is and what it encompasses of.
Good. I think I'll have to start with tourism. See, tourism is an industry, and like in any economy, it is based on demand and supply. Meaning people are looking for services, and the market or the providers are supposed to supply whatever they're looking for. When you take this into the medical section, we have the same situation there, where people in their countries of origin would like to have medical treatments in a way that they will not wait too long, they will talk to the specialists they would like, and of course they could afford it. In some countries, insurances will cover for this. In many countries, like we had in the USA, for example, or many countries in the Middle East, there is no such insurance system, and then when the people have to pay by themselves, they will look for the best combination, exactly. And this is what economy is basing on, and the medical tourism section is based on this.
And also here in Thailand, we've seen that there are many types of tourism, where it is people are looking for the sand, sea, and then we have sex, and now we have surgery as part of the equation as well. In your point of view, do you think that Thailand has a lot of potential in this type of medical tourism industry?
Well, Thailand does not only have a potential, Thailand is the leading hub at the moment in this region. And in principle, we have here a combination of a situation which started about 10 years ago during the old recession, the 97 recession, not the recent one, where hospitals, mostly private, which invested a lot of money and equipment and in educating or training the doctors, needed revenue to cover it, as in every business, what we call economic sustainability. It turned out that there was good response for this. And today, I would say when people look at Thailand, or when they compare Thailand with other medical destinations, they look at the qualification of the doctors, they look at technology, because within technology, we have the diagnostic technology, we have surgeries, we have laboratories involved. They look at the so-called support staff, nurses, the whole environment of where and how you are treated, the friendliness of the staff, of course, and to balance the whole thing, meaning the salt and pepper of everything, is the price. Now, Thailand at the moment is a leading medical destination among the other destinations, and I can tell you later which countries are also involved in the whole thing. But at the moment, Thailand has made the best equation on this, even though we have some, let's say, there are weaknesses and there are strengths. And I would say at the moment, Thailand is having approximately, I would say, 1.3 million people coming just for this purpose.
Wow, so that's a lot of people.
And these are a lot of people, and there is strong potential to increase it.
And also in terms of the recent situation here in Thailand, we've seen on the news that the political instability has caused quite a lot of problems for different sectors, whether it is, for instance, the economy, the tourism as a whole, or even the commerce industry as a whole. For medical tourism here in Thailand, has this economic or political instability played any role or an effect?
In principle, not. Those people who need the treatment, we call them within tourism special interest. They follow a special interest, and they travel by their own will and wish. They did not let themselves be influenced by the political situation. In general, tourism at the moment in Thailand is suffering. But please do not blame everything on the politics.
Yes, there are different factors.
We are having a global economic crisis. People do not spend money in their own countries of origin, whether we are talking about the sovereign debts in Europe or we are having the economic situation in the United States. People are very, very careful before they spend. This is why medical tourism, because they need treatments. They will watch very carefully where they can get the best treatments
for the best price.
For the best price, but without losing quality. Never forget the quality. It is always about health and it's about life, and this is why quality has to be on top. And of course, Thailand is having a double impact. We should not ignore this. Okay, we are having a political situation whereas many countries issue travel warnings, and this has not completely been lifted yet.
Yes.
The media is not doing us a good service either by only concentrating on the catastrophes but not concentrating on the advantages.
Yes.
And this is also influencing a little bit. But it is not only the internal situation. It is really when people look to the so-called most valuable weeks of their life during the year, which is their vacation, they will be very selective. And then this is also applying to medical tourism.
And also, as we've seen, as you mentioned earlier, healthcare is about life and death. And also safety is one of the most important issues concerning different healthcare, different treatments. What kind of precautions or the different systems are imposed in order to ensure that the patients will receive utmost care and also safety when they're traveling here as medical tourists?
Well, when they're traveling, the safety is with the transport companies. When we talk about quality of healthcare, and here I would like to explain that when we talk about healthcare, we talk about three sections. We are talking about medical, which is hospitals, heavy treatments, surgery, very dangerous, urgent, emergency. We are talking about the wellness, which is giving people either pre or post surgery treatments, just preparing them, lifestyle and so on. And then the third section, which has made Thailand actually very famous years ago, is the spa. And the spa is in principle wellness but without accommodation. And when we talk about safety in medicine, it is that all of the hospitals which declare themselves to be international in Thailand have an international certification. They're accredited. They are accredited. There is a so-called GCI, which is the joint certification, and there are special audit companies and special audit organizations which really check the hospitals, they check the hygiene, they check the technology, they check the qualification of the people.
Doctors.
There is, of course, ISO, international standard, which are being applied, and all these hospitals are being valued or audited against this. And I can tell you that the international hospitals in Thailand, they are all certified.
Okay, so that's also a good mark as well, because I'm sure that patients from abroad, they would actually pay a lot of attention towards these factors before they actually plan their visit.
And it has to be published. You see, the people who come to Thailand inform themselves very well in advance. Whether they go just into internet and look at the information that they receive by the hospitals directly, or they go into government information systems and will look there, or they talk to specialized agencies like there are medical consolidators around here, and these companies will give them all the information they need, will also answer their questions, and with certain services, especially with the medical consolidators, they will even give them so-called pre-appointment opinions and preparations, which will reduce their waiting times. Whenever they come here, they have immediate attention.